Hello guys, I am Dr. Dheeraj Masapu. I am a senior consultant in the field of neuroanesthesiology, and today I would like to cover a very interesting topic about general medicine and whether it is going to get saturated in the coming 10 years. Okay, first I would like to tell you why actually everybody wants to take up general medicine, and if you see the first 100 ranks in the NEET PG, they would be taking general medicine predominantly, apart from radiology, orthopedics, and other specialities. So, why general medicine has that kind of a craze? Let us see other few reasons behind that. Okay, what I can think about is a generalist perspective. It is called as generalist perspective means that internal medicine specialist or a general medicine specialist would be having knowledge about everything. So they are the best in diagnosing conditions. I'll tell you why. Because, for example, a cardiologist, if he gets chest pain, and he can go deep into that subject and identify what is the cause behind which vessel is actually blocked. And a nephrologist also related to kidney, he can tell. But a disease never comes like that, right? Disease never comes saying that I'm a kidney problem, I'm a cardiology problem. Disease will present vaguely. So I think general medicine people will score here better because they understand the whole spectrum of all the diseases in the body in detail. So the way they diagnose is excellent. That is the basis behind House MD also, right? That is why I kept House MD thing in the thumbnail, because the way they diagnose stuff is superior, because they have understanding about everything. So the so-called niche specialists, even I am a niche specialist, but the so-called niche specialists might actually miss diagnosing if the disease is related to some other specialty. Okay, so that is where the general medicine actually scores very high, and this is one of the main reasons actually the value of general medicine is there. This is called generalist perspective. And if you ask me, then are you telling us not to go into any kind of super specialty? I'm not telling you. In the video, I will explain you what are the advantages of doing a super specialty also. Okay, just follow the video till the end. And then along with that, the general medicine person, if he's there in a particular community or a hospital, the thing is like prevention would be a main priority. For example, a super specialist would deal when something is wrong, like cardiology, like heart attack has come, and then they will deal it by putting stents. But general medicine specialist, like he will treat hypertension, he will treat diabetes, he'll make sure you don't enter into that kind of a stage. So prevention is that they would be focusing on. And also the next thing is cost effective. See, whenever you go to a hospital, if you reach a general medicine specialist, then for example, you have multiple problems. You have some element of coronary artery disease, some element of uncontrolled sugars, and some other problem. So then if you go to a bigger hospital, you have to go to endocrinology, then you have to go to cardiology, then you have to go to some other rheumatology or so many other things. But if you go to a general medicine specialist, then he might actually treat all those things, and it will be a very cost efficient way of treating patients. So general medicine will be an evergreen specialty. There is no doubt in that. But the problem is we are producing thousands and thousands of people, students right now. So what is going to happen is what I'm going to clarify in this particular session. Okay. It is a very beautiful specialty, no doubt in that. And as a doctor, till now I told what are the advantages for the community. But as a doctor, there are some unique specialties compared to super specialties. Like your knowledge base is very broad, and you have a very flexible lifestyle, I feel so. And work-life balance is better because, see, for example, what I saw in life of super specialists is, for example, a nephrologist who is involved in transplant care, who is involved in dialysis care, on the clock they would be working because they have that kind of a complexity in the work. And in general medicine, you can choose your timings. You can go to one hospital in some particular shift, another hospital in some particular shift, and you can work for some time. And evening you can keep yourself free for some kind of exercise or spending time with the family or something can be. This kind of flexibility you get actually when you're doing general medicine work. Work-life balance would be better. So why I'm telling this is, so now what I'm feeling as I become senior is that, see, you need to have some kind of a balance in your life, and choosing a career which gives you that is the trick actually for that. For example, if you go into neurosurgery or some specialty like that, what happens is you will be forced to come in the night and operate. You will be forced to keep a track of all your patients throughout the day. So that is a disadvantage you get when you go into such kind of a niche specialties. So in general medicine, the advantage that you get is you can actually control your day better. That is what I personally feel. If somebody is contradicting this, you can put in the comment section. And let us go into now the actual math calculation of supply and demand. So let us do the supply part first, and then we'll go into the demand. So For calculating the supply part, I had to go into the details of the number of doctors in API, that is Association of Physicians of India. That is one of the biggest associations, and around 22,000 members are there in the society. So then if you ask me, then is this the total number of general medicine physicians in India? Answer is no, because everybody wouldn't register, right? So you have to consider it at least 8 to 10% more than this. So maybe 30 to 35,000 internal medicine doctors would be there in India. And the next thing that I would like to add to this is, in the next 10 years, 54,000 doctors would be added to the list, because we are producing 5,400 general medicine doctors per year. So this 54 in the next 10 years, 54,000 plus existing 30,000, around 70 to 80,000 general medicine doctors will be there in India. Okay, this is the number. Now let us come to the toughest part, which is the demand part. So demand part, before we go into the calculation, we need to understand what all diseases general medicine people are dealing right now. So common issues like ischemic heart disease, hypertension, asthma, diabetes, chronic kidney disease, pneumonia, UTI, strokes, anemia, thyroid disorders, acute GE, typhoid, cholera, dengue, influenza, upper respiratory tract infections, tuberculosis, and some seasonal disorders like summer gastroenteritis, and monsoon you can get dengue because of mosquitoes, and winter influenza, respiratory tract infections, and round the year TB, and other lifestyle disorders like diabetes, hypertension, all that. So these are the spectrum of diseases internal medicine people are covering. Okay, here there will be an overlap with other specialties. For example, if you take coronary disease, cardiologists would be dealing, or if you take influenza and pulmonologists would be dealing. There is a significant overlap. Okay, but even then, general medicine people will be the first contact for the patients. And also in bigger hospitals, what is happening is the overlap disorders, like for example, if a cardiology patient is also having some kind of a nephrology problem, if both are like going on parallelly, what I'm looking at is more and more those kind of patients are being kept under internal medicine doctors consultation, or under him they will be admitted, because pure cardiac problems only cardiologists would be dealing. So these kind of overlap disorders are being dealt by internal medicine doctors, or there will be some vague disorders where everybody's multiple specialist problems are only a little bit. So those kind of vague problems also are getting admitted under general medicine doctors, and dengue and all those admissions will happen by default under general medicine doctors. So those are the kind of overlap disorders which come under general medicine. So this is the whole spectrum of disorders that the general medicine doctors would be dealing. Now let us come into the actual math calculation with this knowledge. So for example, on an average, a general physician would be seeing around 25 patients in a day. Okay, you can take it as 50, 100, 200 and all that, but on an average it's like for all the 70, 80,000 doctors, you can take it as 25 is a good number. So on an average 250 days, if a general physician works in a year, okay, so then it will be like 250 days and 25 visits a person can deal in a day. That is more like 6,250 OPD consultations is what a person would be dealing. Okay, 6,250 dealing. So this is one part of the calculation, just keep it aside, and then let us come to the second part of calculation is coming to Indian population. So Indian population in 1.35 billion or 1.4 billion, whatever you take, in that what I assumed is a rough calculation, 30% are going to general physician with some problem, because all these are common problems like hypertension, diabetes and all, flu and all these things are very common. So maybe 30% of people would go to general medicine is what I am assuming. That will lead to 40 crore or 4.405 million. In this 40 crore calculation, so this many consultations are happening. So 40 crore consultations, 405 million, if you divide by 6,250 consultations that one physician can deal, it will come to approximately 65,000. So 65,000 doctors are required to deal this many 40 crore consultations. So but in India at present we are only 20 to 30,000, so we are not saturated at present, but in future if you keep producing so many doctors, 70 to 80,000 general physicians would be there in India, right? Even though they venture into so many super specialities, but still there would be some element of saturation in future. So that is what I feel, but future population also would increase, right? So it is like since I already told you it's an evergreen specialty, I feel that it might get saturated number wise, but since it is required in all the areas in India and more in the peripheral locations where rural India the requirement is there, so I don't think it will get saturated, but number wise this is the numbers. Okay, then I'll compare it to the super specialty and tell you about the finances and everything. So now let me tell you a bit between general medicine and cardiology. I would like to compare. So general medicine and cardiology scope of practice. General medicine is a broader scope and cardiology is a specific thing. And how many years of training is required after MBBS? And 3 years you will start your practice in general medicine. So you'll start earning. That's a very important thing. So 3 years of extra time is there for earning for general medicine person. For cardiology, another 3 years of DM. To get DM seat, another one or 2 years of preparation is again required if you want to get into a good institution. So you chilly waste another 4 or 5 years. So you start your practice after 4 to 5 years. So in the 4 to 5 years, general medicine person would have established somewhere actually. Okay. And starting salary on an average, if you join any bigger hospital, around 1.5 to 1.3 to 1.5 lakhs is what you get. In a year, 15 lakhs salary you'll get. In cardiology, if you do join, you get a starting package only between around 2 lakhs. So starting salary can be anywhere between 18 to 36 lakhs per year. Starting salary will be more in cardiology, obviously. Once you gain experience, the thing is in general medicine and cardiology, you can't understand how much they actually earn because everybody's practice is different. For example, after 5 to 6 years of experience, one cardiologist actually is become head of a center and is getting cuts per case or something like that. His salary will be more. Another cardiologist, he wouldn't grow. He will be working like an associate consultant. He will be taking a salary. A general medicine person is working in an organization as a consultant or associate. He is taking a salary. Another general medicine person would have made his own OPD. He is getting 50 to 60 patients in a day. He will be earning different salary. So everybody's salary package will be different. Everybody's earnings will be different. So only starting salary I can tell you, but how you are going to earn depends upon your individual capacity. Okay. And work-life balance, general medicine would be better compared to cardiology because cardiology, I've seen cardiologists working, they would be crazily working harder and it's more very demanding. Okay, and job demand, as I told you, general medicine is an evergreen subject. Okay, and it will be required in any place you practice, more in rural places, tier 2, tier 3 cities than in tier 1 cities. Tier 1 cities, the specialist practice is increasing now. Supply, as I told, MD general medicine, 5,000 seats are there in here, and DNB 434. So 5,400 to 5,500 seats are there. And DM cardiology 528 seats are there, and DRNB 176 seats are there. It's lesser in number, but the centers also will be less, right? And coming to research opportunities and professional prestige, I want to talk about this area. So research opportunities will be more when you go into niche area like cardiology, and professional prestige will be more. Among the peers, cardiologists obviously will have more value and will gain more respect. So if that is your target, then go to cardiology. But if you're thinking about earning more money, if you're thinking about going to tier 2, tier 3 cities, and if you're thinking about actually going and creating impact in larger population, then think about general medicine. So that is my conclusion. And so finally, how to choose which one is better? See, general medicine is a super specialty. That's what toppers will take. But the thing is, after that, if you want to go to specialty, super specialty, subspecialty, whatever you call it, if you want to go into that, then you should understand this video and what I'm talking. If you have to take a call, it is a professional, it's a totally personal decision, and it depends on your ambition, aspiration, and what you actually want to do. And as I told you, it is more about, if you want to be called as an expert, if you want to be seen like an expert doing all high pay thing, super specialty. But if you want to make some change in larger population, be in the general medicine field. But both ways you will settle excellent. Okay, thank you very much for following the video till now. And many people are watching the videos, but they're not subscribing. If you have come till this part of the video, I think you should subscribe to the channel. And if we have more number of subscribers, the only advantage is that we can actually invite bigger people to our channel for podcasts. That is the only advantage I get when the number increases. Okay, thank you very much for following the video till now.